So Pau, I just want to take a few minutes to reflect on my year as President of ADSS Cymru. I really expected this to be a year of commitment and responsibility on key issues impacting social care in Wales. From that perspective, it was really what I was expecting during the year. I did start the year in this office with a real sense of optimism that the pandemic impact would slow and we could look forward, but further waves of the virus and variants put pay to that. And the system pressures, particularly on the workforce, made it another year of response to working differently, but working on a system that has had to continue to react and continue to emergency plan. So from that perspective, it was a really challenging year, and it was a time that required my commitment, required my optimism, required my enthusiasm, and the fact that I needed to connect with many and varied partners. All of this and much more occurred during the year. So what an experience this last year has been. As I say, it was a year of challenge for the sector. The impact or reduction in the social care workforce, be that social work or assessment staff, or the staff delivering direct care in care homes, has been our biggest challenge. The impact of the pandemic, the impact of Brexit and less transitional movement of workforce have created a real lack of supply of workforce. Whilst we've made workforce ADSS Cymru's #1 priority over the last year and have worked constructively with Welsh Government on the delivery of things like the real living wage, the workforce is still not where we need it to be, and we still have people waiting for care and support. So we need to value that workforce and reach parity of esteem with similar roles in the NHS. So my experience of the last year is of course influenced by these sorts of experiences, the key challenges and opportunities facing the sector. I've been honoured, as I said, to have taken on the President role to speak on behalf of ADSS Cymru and its members, and to influence, challenge and promote social care across Wales. It's been a year where it's been more essential than in normal times to maximise our partnership working, to engage constructively, to improve outcomes for people receiving social care and support. It's also been a year for ADSS Cymru to really refocus its key priorities. So launching those priorities and engaging a wider membership in delivering those priorities has been a really positive experience for me during my presidential role. Leading ADSS Cymru in the year when we've engaged, influenced and contributed to the most significant financial settlement for many years in Wales to continue to support funding social care priorities leaves me, and on behalf of ADSS Cymru, with a sense of real pride. Despite this positive investment, we all recognise there's more to do to create transformed, modern, flexible and sustainable services into the future. Working with the members of the organisation and the business unit on setting the key priorities for the organisation and playing my part in setting that future direction is very rewarding also. This provides a real opportunity for me to remind you in this exchange of our ADSS key priorities. Number one, that the social care workforce is properly supported, resourced and valued with the skills and resilience to deliver the high quality responsive services that people need. We want to ensure that people have choice and control in how their care is delivered as priority number 2. Number 3, we want to ensure that people and communities are at the heart of the remodelling of social care and health services. Sustainability is also central to the rebalancing of care and support, with local authorities having confidence that services can meet the needs of people now and into the future. A significant high for me during the year was our summer festival and our annual conference. Fundamental to the success of these events is the input of the business unit that I mentioned earlier, and their input and design of both events is cutting edge. And I think all of the team involved in that I have nothing but admiration for. Engaging with the planning and delivery of those conferences in the President's role has been rewarding and a learning experience for me as well. The standout for me in conference programs has been the showcasing of best practice across the country. And it is so heartening to see the real positive impact our services have on people's lives. It truly is a tremendous thing to view. The low for me this year has inevitably been the fact that we've still operated in a response phase to the pandemic. And that has impacted on the opportunity to network on a face-to-face basis with members of the organisation. I would have loved to have seen people at our conference events, but also to have seen some of the best practice that I referenced that we've seen in those conference presentations. I believe I already knew this, but I'm further informed on how much of an impact ADSS Cymru can have to influence the future direction of social care. We have that influence and respect based on the skills and the knowledge of the membership. Seeing the input members have firsthand was very valuable for me. We really are an organisation which is very well informed from the industry experts. I continue to learn how crucial it is to work well with partners. Also, how many partners we have across government, the care delivery sector, the WLGA, NHS Confed, BASWA Cymru, Social Care Wales, NHS providers and planners, treasurers, regulators, ADSS, to name but a few. In addition, our internal partnership working with heads of children's, heads of adults, as key policy drivers for ADSS Cymru. I've also been reminded how resilient and flexible a sector we work in. Our ability to change the circumstances we face is just incredible to see. It is so important for the President of ADSS Cymru to input positively as a representative of the sector and the responsibility in the role to the future of this organisation and social care. I've learnt the President has to establish a mindset that seeks to secure continuity for this organisation and its objectives into the future. As I said, in the response to the highs during the year, I continue to learn that there is fantastic delivery of service across the country. We need to all capture that, and where service design improves outcomes, we need to learn and adapt to provide the best opportunities we can for our population. I constantly reflect on occupying a leadership role in social care. And for me, it's always and always has to be about the positive impact you can have on improving outcomes for people. And outcomes they look for when they're in need, when they're at a level of risk, they need help, and where we need to protect those most at risk. For me, people are our most precious asset. We need to value the asset, valuing all people as we want to be valued ourselves. A leadership role has to work with people and provide system and personal solutions that improve lives based on what matters. With that leadership comes the need to offer clear guidance, to play an active part in directing positive change, to demonstrate the personal value base that is positive and respectful, and to work collectively to create the vision on how to deliver the services we're responsible for in social care. It really goes without saying that a leadership role in this sector is so very rewarding. Yes, it's challenging. It requires levels of resilience, but seeing positive change is the most precious thing. A leader in social care has to operate with compassion and empathy, and for me, the continued emphasis on a people-based approach should always be your yardstick. I'm really privileged to be taking on the ADSS presidency for another year. In a year when we've had a really positive financial settlement for social services within the Welsh Government budget. However, one of the key challenges for us over the next 12 months is to ensure we have clear plans to deliver a financially sustainable social services for the future. We'll also have to overcome the challenges presented as a direct and indirect result of COVID in relation to the demands on our services and the impacts on our workforce, ensuring we have the right workforce and mitigating the impact on our citizens. I very much look forward to working with you all over the coming year and overcoming these challenges. And the last thing I want to do in addressing you today is to thank you all very much for your continued hard work and commitment across the system of social care in Wales. Diolch yn fawr iawn.